On Alabama's Home Team Health Watch, we're focusing on men's health because this is National Men's Health Week. We're focusing on different health issues facing men. Today we're looking at prostate cancer in men. And joining us now is Dr. Howard Winfield from the West Alabama Urology Associates. Dr. Winfield, thank you so much for being with us to discuss a concern that seems pretty common among men.
Absolutely. Thank you, first of all, for inviting me.
Sure.
Prostate cancer is a major issue, certainly for men. It's the #1 cancer, non-skin cancer in men in the United States, and it contributes to about the second most common cause of death from prostate cancer. It would be expected that about perhaps 1 out of 6 men in the United States will develop prostate cancer, but that does not mean that every man that develops prostate cancer is going to die of it. In fact, a very small percentage of men with prostate cancer die of it. Certainly, if you have a family history of prostate cancer, if your father, grandfather, or brother has had prostate cancer, this increases your risk of developing prostate cancer. Unfortunately, the American diet with plenty of fatty foods increases your risk of developing prostate cancer. And finally, African Americans unfortunately have a much higher risk of developing prostate cancer compared to Caucasians.
Okay.
So if you look at the number of cases of prostate cancer in the United States, probably there will be close to 230,000 men that will die of prostate cancer this year.
All right. What about symptoms? Are they easy to recognize?
Well, unfortunately, there's not a lot of symptoms in the early stages of prostate cancer, and that's really when you want to pick it up. But if a man comes in and says they've noticed a very rapid change in their voiding habits, or if they've noticed some blood in their urine, or if they're starting to complain of loss of weight, appetite, or bone pains, that's rather concerning for possibly more advanced prostate cancer. So really the people that we want to pick up are the patients who have absolutely no symptoms at all.
We only have a few seconds left, but what about screenings for prostate cancer?
You know, I think screening is extremely important, and it's recommended by the American Urology Association that any man over 40 years old, certainly over 50, should have an annual digital rectal examination and a PSA test. And this hopefully will give you the jump start, the head start as far as picking up prostate cancer if it's present, so we can cure it.
Well, Dr. Winfield, we're also going to give everyone a way to get some more information about this topic. You can learn more about services at West Alabama Urology Associates at their website, and for a shortcut to that, just go to our website, WVUATV.com, click numbers and links. Coming up later this week, we're going to be talking about low testosterone tomorrow, and then Friday, diabetes and obesity.